Gen Z has big problems when it comes to behavioral health, with more than 40% receiving a diagnosis. They're also disillusioned with the traditional healthcare system. Is it a hopeless situation, or is there a solution? Welcome to HealthBiz Briefs. I'm David Williams, president of Health Business Group, here with Dr. Sarah Adler, founder and CEO of Wave, which offers science-based, tech-driven solutions to meet Gen Z's preferences and needs. Welcome, Sarah.
Thanks for having me.
How is the mental health of Gen Z?
Yeah, it's a good and debatable question. From my vantage point and my expertise, I think it is not great, to be quite honest. I think that Gen Z is really struggling. There are tons of reasons why their generation is just fundamentally different than ones that have come before. Part of that, of course, is social media and being a digital native. Part of that is just kind of the state of the world these days, and part of that is the fact that Gen Z also, for the first time, has a language to describe what's happening for them. So I think it's all of these things together that are really creating the very true feeling that Gen Z is what I lovingly call the misery generation.
Well, I guess misery loves company, so that's why you started one.
That's exactly right.
So this is just a huge demand for behavioral health services in this generation. And supply, as far as I can tell, is insufficient. It's not growing, certainly not growing fast enough. How do we possibly bridge that gap between supply and demand?
Yeah, I fundamentally believe that the way to do it is really threefold. It is through better data infrastructure that we're investing in to really understand who needs what care pathway at what time. It's the acceptance and the proving out of the efficacy of new care delivery models that really leverage lay healthcare workers like peer counselors and coaches, combined with that data infrastructure and that technology, so that we can really kind of pull people who do not need the highest level of care out from the most intensive and expensive resources. And then thirdly, it is, I think, really an alignment of the financial incentives between the stakeholders, between the patients, the clients, the users, whatever they're calling them, and the people who are actually paying for healthcare in this country.
So you have taken all of these observations and actually put it into action with Wave. What is Wave? What's been your progress so far? And where are you headed?
Yeah, so Wave is a stepped care model, kind of exactly like the one I just described, where we are really have taken at its core an evidence-based intervention that I developed at Stanford Psychiatry, and that we then disseminate using both technology through our app, through our health and wellness coaches, and then we have a data infrastructure that not only provides, using AI, content of personalized content when people need it, but it also allows us to step them up in care as needed. So for example, if you want to be, like a lot of Gen Zers do, self-guided in your mental health treatment, you can use the app, but the app will kind of tell you when potentially you need to bring a human into the mix. It will also then tell you when you need to bring a therapist into the mix or a psychiatrist into the mix.
Well, that's it for the latest Health Biz Brief. If you like what you hear, check out my Health Biz podcast for a full-length interview with Sarah about her life and career. Dr. Sarah Adler, founder and CEO of Wave and professor at Stanford, thanks for joining me today on Health Biz Briefs.
Thanks, David.